Hi, my name is Evan Rothschild, and I'm a medical student at Hopkins. And Jack Christian and I presented Pediatric Emergency Department base screening for home fire safety practices and smoke alarm awareness at the 2025 SAVOR Conference in New York City. We noticed there was a 33% increase in fire-related deaths from 2012 to 2022, with over 70% of those from home fires. Children under the age of 5 and those from low-income households are at the greatest risk for fire-related injuries. Previous studies have shown that functioning smoke alarms reduce fire-related mortality and morbidity. Free smoke alarm programs exist, but awareness and participation in these programs is low. We surveyed a convenient sample of pediatric caregivers in the pediatric emergency room to ask about home fire safety practices, awareness and interest in local smoke alarm programs, and followed up with families after 1 month to assess program participation. For families who lived in Baltimore City, we were able to connect them with the Baltimore City Fire Department by calling 311, and they would come out and install smoke detectors at no cost to the families. For those who live outside of Baltimore City, they can use a Red Cross online form, and similarly, they will come and install smoke detectors at no cost. We are able to connect families with these resources in the pediatric emergency room.
Hi, everyone. My name is Jack Christian. I'm a fellow second year medical student at Johns Hopkins University and was really excited to present this project with Evan early in April at SAVOR in New York. And so, our results of our study, what we saw were we were able to reach 103 families in the pediatric emergency department. 40% of those families had a child less than 5 in the home, which is one of those high risk groups we were really trying to reach. We also saw that 34% of families lived in an attached home, which is what we think of when we think of a traditional Baltimore row home. And these families in particular are at higher risk of fire-related injury and death, as fire can quickly spread between homes, and especially fires have an increased rate of starting in kind of vacant homes that are attached to other homes. We also observed that 78% of families had greater than 3 smoke alarms that were working in their home, which was really wonderful and encouraging to see. However, only 25% of those people actually checked their smoke alarms monthly, which is the recommended practice by the Red Cross. Now, 34% of these families were also lacked or were unaware of whether they had a carbon monoxide alarm in their home, which was also concerning to see. And I think the big other part that we were kind of interested in was about fire safety plans. And 32% of families lacked a fire safety plan, which is another recommended practice of discussing and having a set plan with your family members of how to exit your home in multiple different ways in the case of a fire. Now, when it comes to those smoke alarm awareness programs that Evan had mentioned earlier, there was 65% of participants that were completely unaware of the programs. However, when we introduced them to participants, 50% said they would actually be interested in enrolling, with 37% further expressing interest and indicating they would like to enroll with us. However, we followed up with these participants in 1 month, and at that 1 month mark, only 9% of those families who had indicated they wished to enroll had actually followed up with the program. So, our biggest takeaways from this research were that significant gaps exist when it comes to alarm maintenance, so testing smoke alarms monthly, as well as implementing a fire safety plan with your family, especially among these high risk families with children less than 5 and coming from low income backgrounds that were present in the pediatric emergency department. We also saw that free smoke alarm programs have high interest, but low follow through. So, our future directions in this research are really looking at how we can change and implement these programs to better work and function in acute care settings like the emergency department, whether that's having community health workers follow up with families or just changing the enrollment process from having to call 311, which sends the fire department within 2 hours to your household, which is often not feasible for many families. So in our future, we're looking forward to expanding programs into the Harriet Lane Clinic here at Hopkins, as well as the trauma services to continue to spread awareness about fire safety and kind of proper fire maintenance practices to help to continue to decrease fire-related injury and death, especially in Baltimore. We really hope that everyone takes away from this research that you should test all the smoke alarms in your home monthly, as well as create a fire safety plan with your family to be able to know how to get out of your house in an emergency. We want to give a special thank you to Dr. Tish Ryan, a director of the Pediatric Emergency Department, for her mentorship and support on this project, as well as the faculty at the Johns Hopkins Center for Injury Research and Policy for their support on this project as well. We also wanted to give a special thank you to the Baltimore City Fire Department. Without them, this program would not be implemented, and we are continuing to work with them to increase access to their programs and promote them in the community. Thank you.